joint work between the members of the group. There's 10 of us in the group at the level of consultant and specialist public health. A lot of work has been put into this by all the members of the group, although I'm presenting it, but Dr. Muna, for example, has really done a lot of this, putting this together with Dr. Safa and Dr. Moneim and others. This is how we look in the UK. It's 10 of us, as I said, including Dr. Victor Joseph, who is actually from South Sudan. I'm always very wary in putting this slide over, and sometimes I put it in secret because I'm worried that some of these English Defence League might see this as the invasion plan for the UK. And although we're trying to be everywhere, we're not too many, but there are actually so many people around that we can work in networks very well. And we heard from the UK Doctors Union how many people are there in Ireland. There are even more in the UK. And a lot of them are interested in working with the diaspora works. So how did it all start? We're all members of this group, born and trained in Sudan, so we have all our sympathies and of course our love for Sudan. And all of us had postgraduate clinical and public health service in Sudan, and some have actually completed their work in Sudan and went then to the UK for further training. Some of the key pieces of work that you probably all recognize is the work like in malaria research and establishing the research for unit for the ministry, including the first trial of impregnated bed nets in the country. These are things, of course, which, although can be put in small titles, but these are the sort of things which actually save millions of lives. So I'm saying to my friend Suhail, I don't know where he is, if you are sending all these save life boxes, we are saving many more lives here. But of course, it's all a work together activity. The bed nets, of course, is something that we're really proud of and something that took off. We didn't supply the bed net, but it's actually members of the group, especially Dr. Muna and others, have actually been involved in this, and Dr. Dalia. So we came to the UK at different times, 15 years ago or 17 years ago in my case, and I always see this as a long time. When I say it to others, they say, oh, you're still a baby. But essentially, this is how long it had been. But if it wasn't for such organized work that we could do together, I don't think we could have been at all proud of whatever we have done in the UK. So we went through the public health training, and we set this, the network first in 2003. People came together and started thinking we can do things separately, but as Dr. Suhail said, actually doing it together makes the big difference. Doing it in an organized way and actually involving more people makes the sum of the parts much, much more than the individual bits. So we co-established this Sudan Public Health Consultancy Group, and this is another point, is actually when you go into more organized organization. It was started as a network, then we went into an actual consultancy group which is registered and has a company name, accounts, and so on. This, although it wasn't at all easy, but it makes the commitment and the work and recognition actually much more stronger. So what happened then? Essentially, this work became more organized, so we could work more directly with the Faculty of Public Health and the Association of Medical Royal Colleges, for example. We could actually contribute into projects directly, and these had funding and so on. These are members of our group, some of our group who came to the last one, last Diaspora meeting. You can see Dr. Muna, I don't know if you know her, Dr. Joseph there, Mayada, and Ishraqa, and Dr. Huda. And this is our website. I invite you all to have a look at it. It's quite, covers most of the work that we have been doing. And what have we been doing in this organized way of working? So this establishing these professional links with the service and academic institutions in Sudan was a key one. In terms of capacity, what we can do of actually passing skills and co-production of activities is much bigger than actually being involved directly, but we do that as well. So this memorandum of understanding with the Federal Minister of Health was signed in order to do this sort of work. And also another MOU with the Royal Colleges and the Faculty of Public Health in Sudan. And this is now being for 4, going to the 5th year. It's a 5-year plan. And that included direct work with Sudan public health institutions and overall hospitals and ministries of health, and to support the specialty training and support also specific projects there. Indeed, actually, what happened is a series of involved work in developing the curricula, for example, and developing the specializations. But also there is I think a key one in around actually developing the links between the postgraduate activities in the SMSB especially and the training in Sudan, which is, I think, follows the work that the other parts of the medical system has been trying to develop with the UK. The idea around public health especially is that it's one of those areas which is so much needed in Sudan, indeed in all developing countries. I would dare say much more than the other specialties, because it is what actually saves lives. So as much as we would hope that we have grand hospitals of all types and shapes and colors, but actually that even in the UK does not save lives. The actual impact of the high end of medicine and surgery and so on improvement of life expectancy. Could anyone take a guess how much? If from the post-war era, in the UK it was the life expectancy was about 50 years or 45 years, and now it's doubled to 90. How much has been the contribution of medicine and surgery? That's on hospitals and so on. Any guess? Any givers? How much? How much in percent? Sorry, 8? 10%? Any more givers? No guess at all? It's actually less than 5%. So that huge 85% has been actually an improvement in housing, in sanitation, in water, in education, immunizations, antibiotics. This is what saves lives. Not that complex and very nice surgery with all the anesthetists sitting up there and the cardiologist. And my wife is a cardiologist, so I always tease her, how many lives have you saved today? A couple. Well, we saved quite a, even in the UK actually. Every immunization is a saved life. Every screening is a saved life. Every activity like that is actually either added life years or quality to life. That is what the realization in the UK is taking part. The 5-year forward view, for example, if you have read that by Simon Stevens, the whole world is above it. It has prevention at the top there. The whole issue now that the NHS was, it's 140 billion pounds, and I said that to the Minister of Health in Sudan. Can you afford 150 billion pounds? You will not. But even if you can, it will still not save you, because it's not helping the UK. The UK now cannot afford it. It's unsustainable. And they're looking again back at prevention. And what is happening in Sudan is that we are following that model, that old model that the UK want to leave. So we are actually following, we actually have to cut that cycle and go to the actual, it's actually in the WHO, everybody has been recommending it. Anyway, so this is the memorandum that we have signed and with the President of the Faculty of Public Health, and they're so keen, amazingly keen, to actually help us and work with us, despite the political issues. But they are so keen to work and to increase capacity, because that's part of the global strategy for public health. A key part is that this has become an exemplar for other activities, like Public Health Africa, for example, just started based on what we did for Sudan. Other groups like Nigerian groups and others, they came and learned from us what to do, and none of them till now has actually a registered group. So in a sense, the faculty used our methods and actually asked others or developed its African strategy and its global strategy based on it. what sort of achievements? A lot is in the paper, that is in the handbook you have, but the key part is these wide determinants issues. So giving and helping the system in Sudan to realize the issues, how does these wider determinants actually affect health? And how does the distribution of facilities in Sudan actually affect that? Things like maternal and child health, mortality, underweight, diseases, of course, the infections, especially HIV, TB, and malaria, and non-communicable disease, the new epidemic, essentially the chronic diseases, and things like injuries, for example, or accidents, and so on. That actually, this graph shows you, just gives you an idea of a concept that in Sudan, inequalities in Sudan, we only talk about who has that bright new Mercedes or BMW and who is eating out of garbage. But actually, the fact is it's it's the basis of a lot of other things around, especially around health and well-being. But it extends much further. So this graph shows the plotting of the mortality rates against the number of health providers in a state. So essentially, you can see that, well, you could expect in some places where there are per population, per 100,000 population, there are more. And here we're not talking about big hospitals. We're talking about shafakhanat and nuqat ghiyar وكده. Very simple things. But the more there are these interventions, preventative places of interventions, the more it actually affects the mortality rate. Very simple things. This is maternal mortality, one of the easiest way to measure inequalities in health, like infant mortality as well. Again, this is another graph of the work done by the group with the Ministry of Health about the impact of injuries and so on. And you can see things like road traffic accidents affecting so highly. Falls is 1/3 of accidents, simple things to prevent, and they cause deaths and so on. Again, work like on the female genital mutilation, where again, just some analysis and guidance around that shows that the education, female education, for example, will actually help much more than any other activity. Leadership training is another key one. We take in Sudan leadership as something fakaka zay ma bqul sisi. It's most something that people are born with. It's actually taught. There is a science. It's actually something that people need to understand if we want to close that gap. And a lot of that work can actually, we can transfer those skills, and we are working already with the ops and gynae and surgery and through the SMSB and so on. Public Health Institute, another very big, actually almost a big part of it has been through the involvement of our group, especially Dr. Muna, who was the deputy director there, and she transferred, she worked there, she went back from the UK, that's, I think, was the most courageous thing she did. She worked there for 4 years, and she developed so much of the activity and the principles and the strategies around it as the key change transformation force in Sudan. Worked in education and training, research, consultancies, and it had a transformational strand of work as well as transactional in terms of lectures and courses and so on. It has already, and this is the key part in this developing leadership, as we said, it's actually developing this culture. So till now there had been MPHs and Masters in Disaster Medicine diplomas in leadership and so on. About 300 people graduated and up to 450 more. These are the changers for our future, and we need to empower them as much as we can in a systematic way. And other work that we were involved in, the National Cancer Strategy, Malaria Program, Health Impact Assessments like for Khartoum Refinery, and epidemiology and zoonotic diseases and similar, and the 5-year strategy and so on. And also forums around the workforce again, and leadership and developing capacity. Finally, well, comes back again, what is happiness? Is that inspiring leadership? And actually, someone said, and I think this is the King's Fund, leadership and system leadership, especially whole systems leadership, is where you actually stay back but push the others. And not that you are pushing them into a cliff or something, but you're not trying to catch the light or to be the one who is important or to be the one who is well known, or to be the one who is selected 4 times for presidency or anything, but actually the person who empowers others to develop their activity. And so it's a matter of how we develop these capacities and develop these abilities within our colleagues, and actually to empower and to tell them, yes, a lot of people have actually had to leave Sudan and go and so on, but even those who are still there, who are with you, who are supporting you, who are making you stronger, and we will always be with you. Thank you very much. This is, by the way, just one of our colleagues, Moneim, there at the back, is our artist in the group, and shows how we are trying all to work hard around this. Thank you.